We're talking about the science of scar therapy, and particularly we're going to talk about the Skinuva. So Skinuva is unique because it's a science-based product. I love the fact that when I met the Skinuva team, they actually said, hey, we developed our product. It has growth factors in it. And then we did some studies. Imagine that. They did studies to prove that it worked. Right. And actually their studies proved that it had about 2x improvement in scarring. And so that was really compelling to me. And actually I switched over my whole scar therapy program to Skinuva, and I've been extremely happy with that. But the science of these things that we use are really important, correct?
Yeah, I think it's pretty common with high ticket items. We expect those to be validated with the studies. But with these lower cost items, often it's just something that a patient's buying on Amazon, right? So it's not something that's always well validated. So I agree with you. If there's a product that brings new technology and can differentiate itself and then be validated, I think that's huge.
I think you're holding one of the newest releases, right, from Skinuva, which is a 75 cc size. So there's 30, 50, and 75 cc's now. What are your thoughts?
Well, I think anything that is evidence-based and tested when it comes to scar therapy, like you were saying, is absolutely a must and revolutionary for what we do, which is put a lot of scars sometimes in the body. But what differentiates Skinuva? What is the actual difference from just a plain silicone-based formula?
Yeah, typically, silicone itself has been proven to reduce scarring. It's really the hydration of the scar. So the company has looked at what are growth factors that improve scarring. And so they've incorporated these into their compounding for the product. And then they've done studies, and they've got actually 5 studies now that show improved scarring, I think up to 2x improvement in scarring compared to controls, which is really phenomenal. So you still can get the hydration part, but there's also other factors that are in there.
What we do, we're trading off an improvement in contour or appearance for a scar, and it's probably one of the most significant barriers. Like patients who are coming in for an abdominoplasty or a tummy tuck, they don't like the scars. Or even for a breast lift, they don't like the vertical scars. And so you have to have some option for them to minimize those scars, because that is a real deterrent for some people to schedule surgery. And so I think it's critical.
Yeah, and I think it's almost, it's a incentive for patients maybe to come to you, because Dr. Bajaj, she has a scar therapy requirement. I'm going to have her do my surgery. Nobody ever thinks about that, but it's a big deal.
And it's even a bigger deal for a lot of women of color, because I have a lot of patients who come in who aren't Caucasian, and we all know that if you're darker skinned, sometimes your scars are just not as, they don't heal as well. And so it's a big concern for a significant chunk of my patients.
And Dave, in terms of your specific recommendation to patients, how do they apply it? How long? How does that work?
So I typically have patients start their scar therapy basically as soon as the scars are healed, at about a month after surgery.
Yeah.
I'll usually have them apply it morning and night. I usually tell people, get out of the shower, dry off, put it on, and if by the time you go to put your pants on, it's still wet, you put way too much on. Yeah. And I usually have them use it for up to a year. During that whole time the scar is maturing, and I've found, with what I've been using now, that to be very effective, but I'm excited to give this a try.
Yeah, so the Skinuva products also come different sizes we talked about. There comes with the sunblock. So you'll have some patients that get hyperpigmentation, and so the Skinuva Bright's been developed to treat that specific type of scarring and situation, which is great. And actually, I've had excellent success with the Skinuva Bright.
That actually sounds fabulous. I get a lot of PIH in my practice, and so anything that can help correct that, the added growth factors, I think is an added bonus, and definitely something that nobody else offers.
All right, well, I know each of you you're really in the learning phase of Skinuva, but I'm sensing some excitement here that you guys may be placing an order soon, which would be great. You won't be disappointed, I can assure you that. The science of scar therapy is well established, and I think Skinuva really is at the forefront of developing science-based scar therapy. Patients are very attuned to this, and it's just a great incentive for patients to actually engage in getting the best scar that they can for their procedures.